money is for Christmas, and it can allow you to go if you don't pay your bill. And then next time you go to Dr. Alia's own clinic and he does that, they will mark you Nigerian the frequency. They will say, oh, they are very kind people for Christmas. They will be calling and they run you down. You come back to the United States and say, oh, don't forget about investment in Nigeria. It's no good area. That is what I think in that aspect. Having said that, I want to just give you 1 minute to really make an intervention on the general presentation they made here. One aspect Dr. Nnamani did very well is in the area of national health insurance. I have nothing to add there because she has represented the government very well in her presentation. Thank you so much for that. You are so well informed. But the only thing I need to do is just to declare call that you should advise your members of family back home. Very importantly, just like we have minimum wage in Nigeria, minimum wage is between federal staff, federal civil servant, and then component other servants in the organized private sector. Sometimes now that the labor is negotiating with federal government for upward review of their salaries, they will finish doing this, and then the immediate implementation will favor us first. The federal civil servant will start chopping it. Now, the organized labor now will begin to make case, and they'll be making for all their employers now to pay, even at the state level. When the last minimum wage was made, some states were unable to pay, even though the federal government started paying its federal staff. The same thing applies to the issue of national health insurance. The organized private labor have been making cases, different organizations for their own staff to fall in line to be able to make this special arrangement for their things. As soon as this arrangement is done, definitely it will also be extended to them. And like she rightly observed, the payment of bills for your pocket will be highly reduced. The last point I want to make is on the issue of medical tourism. I have been engaging AMPA at their level, national level, from Atlanta, because I challenge them on this issue of medical tourism, that is Sunday medicine. I will look at it, or yearly medicine. You go home within a space of 1-2 weeks I remind my mother, who has been they never knew that she had diabetes. But the fourth time you diagnosed her and they let her understand that she has her diabetes. You have really excited her that she has a terminal sickness, that she will die if attention is not giving her routine periodically, okay? Now you finish that 2 weeks and return back to the United States. There is no succession plan, continuous productive plan in terms of how you are going to sustain this treatment. You go back until another 1 year, you will come back again to come and give another 2 weeks. How do you expect her to continue that? That is why I challenge the medical doctors, the pharmacists, the nurses in the United States and within the area we cover from Atlanta. There is need for her to establish at least one referral hospital. This will take care of this issue of Sunday approach you make. You understand it? Well, we do very well through medical tourism, but I think it is not really what we need at the long run. It is advisable that you have the capacities, you have the training, you have the finances, you have all it takes. If you can gather your resources together to come and establish one, even if it's only one, you would have saved Nigeria that money that go to the drains in the name of medical tourism. So I thought I should mention this place. Yeah, thank you so much. Thank you.
Can we give the mic to our chair, please? Then you guys can conclude, the panelists, because our chair has some contributions to make, being her field.
Thank you, everyone. Talking about health, really we're talking about preservation of life. And our sister did well on the insurance scheme. Even in the great America, not everyone has insurance. They still get there, and they're still treated. You see the topic, development efforts. We're not saying we have gotten there. How can we change the scheme of things? How can we make things get better? So the insurance thing is good, but even if you will continue now, okay, it's not every family member in Nigeria that has somebody abroad to, open up the insurance stuff for them. So anyhow, we still need that scheme that will help Nigerians who cannot afford medical, help with the medical financing. No matter how we debate today, there still have to be that portion. Like I said again, in the great America, there are so many people who do not have that scheme. So there should be a portion for that for Nigeria. We are called developing country, you know. So there's still the same way. So there's really no monopoly of knowledge. Talking about the medical mission, Americans themselves still go to places for medical mission. And guess what? Even in America, for those of us who are field nurses, we still do medical mission. You cannot rule it out. You know, when you talk to somebody who knows what to eat, who knows not to drink because he has this, who knows not to do this, and you're in a great America, developed. Nigeria, we have not started work there. So medical mission can never be overruled. Yes, there are other things we can add to it to make it better, like consistency, you know, which is very, very important. And that was why when we went for the Diaspora Day this July, we made a presentation to the federal government. And we're like, we're coming in a new way. We are coming talking about sustainability. How can we continue? You know, there's a program, we have a committee, Professionals Without Borders. When you are home, how can you, you know, consistency. So immediately after that, we started a medical mission, visited Ogun State, Ayekwe, for 1 week we were there. Then Ebutameta in Lagos. I wasn't a part of the Ebutameta because I had to leave, but it continued. In Ayekwe, after we finished, I was on the triage. I know hundreds of Nigerians that I saw, 200 and something blood pressure, 199, and they're so, oh, it's because of what I ate yesterday, it's because I was jogging last night, I just had a fight. They don't understand. Anyhow, because you've not gone through, you know, you're just one person. You've not gone around the 36 states. So you have visited where you have visited. There's other people that have not been visited. There are other people that do not know what is going on. And what did we do after that medical mission? We tried to reach out to, you know, talk to other doctors, because we collaborate, even doctors in Nigeria, how those people can continue to be seen and all that. So that consistency is very, very, and another thing that NIDO told the government we want to do is, you know, refurbishing our health system. Of course, we want to go and build new ones. But we have systems that are already in place. How can we help to grow them? How can we develop them? How can we do things to make things better? And talking about what my brother said about you going to the hospital, and it is true. It's still happening. I better give my father money if he's going to, or he will just be there. My own mother, my only child, my own mother, with money even in her, you know how it is now, was left there in the ambulance or bus or whatever took her to the hospital, because they needed a family member, whoever, to go and register. She was comatose, hypoglycemia. She even had the money. She died. And that is why, by God's grace, I'm standing that people will not die, you know, if I have the opportunity to help. When I was serving in Ekiti State, one of my childhood friends, her younger sister, we say youth corpers are Nigerian federal government Pekin or child, it's a lie. She had, my friend, friend's sister had an accident. So it's not story, somebody that was close to me. In a pool of blood. She was left outside the hospital because there was no one. To worsen the situation, she was on the uniform. Yeah, oh God, you don't want to know. Yeah, it's been a while, you know. But things still happen. They still leave people to die in Nigeria. So forget about the youth service. It is still happening. You know, so we're not here to support or negate the fact or say, oh, this is not doing this. How can we help to make it better? Because it is actually happening. It is actually happening. Thank you.
It's still happening.
Thank you. What I'm going to do is, I'm going to give the panelists a minute, please. Let's not circle the wagon and keep regurgitating the same. We understand what the issues are. We're only here trying to exchange ideas on how we, the diasporans, can help, you know, with our motherland. That's what we're having this summit. What do we have? The resources we have abroad that we can bring to bear with the situation in Nigeria. That should be our goal and focus as we try to brainstorm ideas in this hall this evening. Please, a minute 8 to summarize.
All right. The question is, what would those in diaspora do? And I'll highlight them. For those who do missions, all sincerity, the problem is with mission, it's usually fragmented. The question is, who goes to Nigeria? What are they doing? How are they doing it? What impact are they having in the community? How are they following it up? We have no idea. So one of the things I actually met with Abike Dabere when I went to Nigeria. I said we have to have a database of all those who do missions in Nigeria, who collate them. I mean, I'm glad that the embassy people are here, and something we need to start discussing. So everybody who does mission in Nigeria will register. Register, put your name down, and we'll put all your members who are down, what you're doing, and how you're doing it, where you're doing it, so that we can keep tab and be able to keep statistics. Data is important. I've mentioned numbers. I've given you numbers. Because these people keep data. We don't. And that's one advantage that we have above us. That's one. So we need to do that, and NIDOA would have to create a portion to find ways where we'll talk about that. Then the next one. Look, they say every politics is local. And when I ask people here, who is your mayor? Most people know who their mayor is, except those who do doubles. However, but that's a different story. Who is your local government chairman? Most of us don't know. Find out who your local government chairman is. If you go home, visit your local health center. See what it looks like. I did. And for both local government chairmen, I met with both of them. Isoko North, Isoko South, Delta State. I met with them. They know me. And I asked them questions. Why? I'm beginning to hold them responsible. I dragged them. They went to the place to see eye to eye that this is the deplorable state of which the healthcare system is here, where a baby is being born. In fact, if you see where the women are giving birth to our generation, those who are going to carry our names forward, is deplorable. We should be ashamed. But I brought them to come see it. They saw it. So you begin to hold your local government people responsible. But if they're not, then guess what? No. Gather yourself together. Those who do not support your agenda for good, vote them out. Because that's what they do here. Vote them out. Gather your money together. Those who you think will support your idea, put it together, you support that person. I did that. I gather people together, we voted people who we can talk to, who can relate to us. That's another one. Now, when you go home, the first place you land is either Lagos or what? Abuja. What is the healthcare system in Lagos and Abuja? Have you seen it? So, what am I saying? Adopt a unit. Adopt a unit. Go to Lut. I went there. I went to Lut. Pick the pediatric department. Pick OBGYN. Spend money. If it's their waiting room, rehabilitate the waiting room. How much would it cost? Ask them how much. 200, 300,000? Because when we come here, we go to these hospitals, we see those places, we sit down, air condition, looking nice, nice chair. Look at the wall. James Pavilion. Jozeski Pavilion. These are people who put money down. They do that. We should begin to start doing those things. So when we ask ourselves, what are we going to do? Those are the things we do. Before you start thinking of carrying to go and build one big hospital in Nnewi, how many people are there? And which are the specialists who go and sit in Nnewi? I'm sorry to say, but in the village, they're Bagana. No, it's a fact. They will not. But they will sit in Lagos. If you make Lagos conducive enough, create a Lagos loot. Make it decent, make it good. Adopt a department. Make it good, make it decent. Guess what? It will trickle down. It's called the trickle-down effect. China is doing it, and that's what they're doing. So, and that's how much I will say. Thank you.
Well, to wrap it up, I will also say that I have two things I would like the diaspora, Nigerian diaspora, to continue, to consider doing. One is looking at the primary healthcare system, which Dr. Nelson has mentioned. they say the foundation of every healthcare system is primary health. So just like he mentioned, if we look at, I know that there are so many Nigerian associations in America, and most of them, it's either their state association or a local government association. I would go by what he's saying. I think that would be very laudable. When people say government do this, do that, I ask them, John Hopkins, is it owned by government? There's so many hospitals in America that is not owned by the government. The people that foundations build this. People, spend money on, to raise institutions. So let's stop saying government should do this and do that. What patient said in terms of somebody being left outside and all that, if the person had health insurance, that's why I asked her, I said, how many years ago? Because let us stop talking about things that happened millions of years ago. Nigeria has changed so much. If they have health insurance, nobody will be left. Right now, people are not left there. If you have the ones that are being left there, is either they don't have, and I don't even know. I've never, that's why I told him, I said it has been reduced drastically. What he mentioned in terms of people left in the hospital, yes, it's a business because 90% of the providers, the health hospitals there are privately owned. So you have very few government hospitals. Yes, if you look at our population, 90% of hospitals in Nigeria are privately owned. So yes, you have to pay them, but I'm saying that all of them now, when people come in, the first thing they ask, health insurance, which HMO is covering you? So people are not being left to die. People are being treated now. So that's what's happening. Let's talk about what is happening now, not what happened millions of years ago. Nigeria has changed. So your contribution, look at the primary health centers, see how you're going to, because that's the foundation. Before we're even thinking about all the castles we're going to build in the air, the primary health centers are key. And if you look at Nigeria, where we are in the tropics, the prevalent health issues are mostly infectious diseases, and these things can be treated at the primary level. Then the second one is healthcare financing. If people here register, they say there are over hundreds of thousands of Nigerians in America, Europe, wherever, around the world. If all the diasporans register their family, let me tell you how they will help, because you ask the question, what are people who don't have their family? What happens is that as more people, I told you there's a plan of 15,000 now. As more people are coming into the pool, the premium is reducing. So if everybody, let's just talk about America. Take 5 states where you're heavily populated, Nigerians here. Let them register their family, because I'm sure for every Nigeria caters for about 5, 6, 10 people. So if you register them in those plans, it pulls money into the system. Now this money will be used for skill. We'll use it to train nurses. You need it to build infrastructure, like what he was talking about, rehabilitating the primary health system. Imagine a community, let's say Isoko community here, decide that they will register all their relations and give them health insurance. Once they do that, and they say, okay, all of us registering people, they will all go to Isoko primary health center. What it means that money is being paid into that Isoko primary health center. They will use it to train the nurses. They will use it to make sure that there are drugs there. Then they will also use it to rehabilitate, revamp the primary health center. Before you know it, as more people are coming, they will buy ambulance. So that's what happens. Health insurance helps to pool money. That is the approved healthcare financing for anywhere in the world, but even being preached by WHO. It helps to pool money into the system so that the system can grow. So all these things we talk about, quality healthcare, the nurses are not trained, all this, as more people are coming into the pool, you will have all that sorted out. American health system is surviving because they have health insurance. Everybody is paying, and not everybody is using it. So what happens is that many people pay, and then few people, the people who use it, the ones who don't use it, people who use it are being paid for people who don't use it. So, and like you said, it's developed, but not everybody. So there's no way Nigeria can also cover everybody. But I said at least many people will be able to come into the pool. If if people look and register, healthcare is still considered, you still have to look at the ability to pay. That's what the government will look at. So that we actually know those ones that cannot pay. If many people pay, then the government is able to sort out the ones that cannot pay and then subsidize for them. But as it is now, everybody is parasiting on the government. Even people who can pay don't want to pay. And the government has competing needs. I personally don't subscribe of that thing of waiting for government to do everything, because really, there's some things we can do to help the system. So I will talk about people buying health insurance plans and also looking at the primary healthcare centers. I think community people can bring themselves together to adopt a primary health center. Thank you.
Yeah, we're concluding this session, and please, let's put our hands together one more time for our panelists. Before we go into the next segment, panelists, we can now look at the table. Thank you so much. Before we go into the next segment,